Hey guys, I have been trying to get treatment for this parasitic disease. This area on my face is lesion. It's got some makeup on it, so that's why it's that color. But it, had a lot of egg pods and all that, and I had pulled them out of the pores. Well, now I'm trying to clean it, so I was taking this cap off of it, and I just wanted to kind of get a good close-up of what all is inside it. And it is definitely filled with parasitic activity. I'm going to put the phone down so that this one can be still. This one is moving all over the place. I've got testing en route because we have a strong suspicion that it's filaria, but we also have a strong suspicion that there's a strongyloides in the mix, because a lot of times from breeding, filaria and strongyloides go hand in hand. It's just sliding off really easy, and it does not hurt. It's just got makeup on it mixed in with a little bit of a scabby, dried area. And it's about the size of a quarter. So it's full of parasites. These white worm things that we see now, they look, I used to think that those were like strongyloides, but from what I'm reading and what the images that I'm finding, these look like filaria. And I'm trying really hard to make sure that, I get the right testing and the right medicines. That is proven difficult because the healthcare system does not want to recognize parasites because it's not lucrative, and they would rather people die than to lose money. If they're going to pick a condition to ignore, to me, parasites is not necessarily the best one to pick, because they're contagious, and this could happen to somebody that those doctors love and adore. And while they may think that they could step in and do rescue on those people, they may not always have the opportunity if that person doesn't want to share their embarrassing situation and they're trying to find help elsewhere. I was in the hospital recently at Houston Hospital Northwest. We call him Dr. Bala, B-A-L-A, but he's Indian and his name is larger. I just don't know exactly how to say it. I don't want to brutally mess it up. So it's B-A-L-A-S-U-B-R-A-M-A-N-I-A. Subramania, something like that. Bala Subramania. I just want to make sure that I'm not mispronouncing it. But he saw me immediately, wanted me in the hospital because my health was so bad. Well, the infectious disease and Dr. Bala got one look at my medical record and they saw all of the doctors that had blown me off and dropped the ball and not ordered properly and strategically manipulated medical records. So they immediately wanted me out of their hair after having admitted me to their hospital. So they delayed treatment. Then they gave treatment, but they gave half the recommended frequency. And when they kicked me out after 2 doses, they did not give me a prescription. I had to go back to Dr. Bala's office, and we had to go back and forth because he wouldn't write the prescription properly. They have refused to report this, and they have refused to help save my family across the board in the healthcare system. We are going to fix this for everyone. So I'm going to try to clean this up and get it medicated. This is Billy with a big gash on her face, preparing to take somebody down at their knees. And Billy's not going to take any prisoners.